everyone, my name is Syra and I'm here with Key, Catherine, and Megan, and we are here to present on the evaluation of the Los Angeles FIMR program. The FIMR stands for the Fetal and Infant Mortality Review. FIMR is a community-based, action-oriented process that's intended to understand how the social determinants of health collectively and individually relate to fetal and infant loss. There are over 160 FIMR programs in 27 states throughout the United States. FIMR is supported by the National Center for Fatality Review and Prevention and local public health departments. FIMR is specifically a part of the Title V block grant for maternal, child, and adolescent health. FIMR typically operates on a two-tiered system, including a community review team and a community action team. The community review team reviews and analyzes cases of infant deaths in the community. The community action team receives recommendations from the CRT and translates them into actions. The personnel of the CRT and CAT include some overlap, but generally the groups are composed of culturally competent individuals with diverse professional backgrounds as well. The Los Angeles County FIMR program is implemented by the Maternal Child Adolescent Health Division at the California Department of Public Health, and it is at the county level. The LA County program exists at a single tier structure, which is different from the typical two-tiered structure. There is extensive collaboration and partnership of the LA County program with outside organizations, some of which are included on the slide. But the primary ones are the Research, Evaluation, and Planning Unit and the LA Hope Project. The LA FIMR program targets 15 zip codes within the county. Their populations of focus include African Americans, Black immigrants, and families. The reason for this focus is because of higher infant mortality rates compared to other ethnic and racial groups for the African American population in Los Angeles, in addition to African Americans representing the highest rates of preterm live births and low birth weight live births in LA County.
So before our evaluation design began, we decided to do some research on previous FIMR evaluations to see what we could find. We chose two studies to present to you. The first was a national review that was an evaluation conducted by Dr. Meeser in 2004 that looked at the intermediate outcomes of 74 FIMR programs around the country. They looked at program implementation characteristics, development and implementation of recommendations, and things like that. This evaluation had many interesting findings, but one that's particularly relevant to our evaluation is that they found that the program structure, meaning separate CRT and CAT versus a one-tier joint structure, had a significant impact on program outputs, specifically with the implementation of recommendations, with the two-tiered structure having significantly more recommendations implemented. A second study that we're going to talk about is a 2012 evaluation of Louisiana FIMR programs, which compared the FIMR program implementation in Louisiana to the national program recommendations. They found that while their programs mostly followed national recommendations, the deviations that they found in their implementations were usually the result of a more appropriate or Louisiana-specific need or function. Given that the LA County FIMR program deviates from national recommendations in a way that the national review shows has been less effective, it's important to know why, but the Louisiana evaluation showed that the deviation is oftentimes something more contextually appropriate. So that leads us to our evaluation question. Next slide. So we want to do a process evaluation of this program to investigate what is going on in this implementation and how and if the deviations the program has manages to complete the required program activities. So our question is, given that the LA program does not follow national FIMR recommended two-tier structure, how has the LA FIMR program balanced their team membership, team responsibilities, and team activities in their combined team structure? Next slide. So here's an adapted logic model that our team designed specifically for the LA FIMR program. And here you can see some more specific inputs and outputs for this particular program. For our evaluation purposes, we are interested in looking at input with aspects related to the review team panel, which is that one team structure, and some output elements concerning the balance of activities of program meetings, as well as staff opinion on how effectively the team is developing implementation strategies and how good they are at finding root causes. Next slide.
In our evaluation, we'll be using a mix of both quantitative and qualitative indicators. First, we'll be looking at the number of recommendations made by the team and the number of recommendations implemented. This is important since the prior research showed that there may be a difference between 1 and 2 tiered structures. We're also going to look at the number of activities that the LA program implements and how they're categorized under either CRT or CAT activities and the full breadth of activities recommended by the national program. We're going to look at the ratio of CRT and CAT team member roles represented at the FIMR team review meetings. And lastly, we're going to look at the FIMR staff satisfaction with the team effectiveness, including the number of recommendations made and the efforts to implement them. This last indicator will be a mix of quantitative scales rating satisfaction in different areas, as well as qualitative free responses on opinions regarding the team structure and function. We're using a mixed method, non-experimental study design. There's no true comparison group in this study. However, we will be looking at the LA FIMR program processes and comparing them against the National Center for Mortality Review and Prevention program manual that recommends activities for FIMR programs.
We propose the following data collection methods. Number 1, observation of team meetings, where we propose recording the staff present, differentiating if they are CRT staff versus CAT staff, and categorizing topics and activities of meetings into CRT or CAT activities. The second data collection method that we propose is documentation review. Evaluators will review the minutes from prior meetings and categorize, as during observation of the team meetings that I spoke about earlier, the present members and activities into CAT or CRT buckets. And the third data collection method that we propose is the satisfaction survey. This survey is meant to interview participants and ask them about their opinions of the structure of the FIMR process. Next slide, please. For both the observation of team meetings and the documentation review, the evaluators can use the same form to categorize information from ongoing meetings or meeting records. This is the form that is displayed on the left side of the slide. The data collected using this tool and these methods will supply data relative to the quantitative indicators described previously. And the image on the right is the satisfaction survey. The evaluators can use the team satisfaction survey provided by the National FIMR manual. This satisfaction survey will supply the data relative to the qualitative indicators. Next slide, please. For our 3 data collection methods, we propose the following sampling. For the observation of team meetings, we will have evaluators observe and collect data on all FIMR team meetings that take place during a period of 6 months. For documentation review, we propose using stratified randomization to randomly select the minutes from 2 meetings per year for the past 10 years to be reviewed. And for the satisfaction survey, we propose administering the survey to all team members throughout the meeting observation collection period. So basically for the 6-month timeline. Next slide, please. This is an illustration of the overall timeline of the evaluation plan. We expect the overall evaluation rollout to happen over a period of 8 months. The evaluators would be spending about a month and a half in finalizing the plan, developing and finalizing the tools, and also training staff. Data collection will start in the beginning of June, and once they begin to collect data, data analysis will begin parallelly. The last 2 steps are to present our results and findings and produce the report and disseminate it with relevant stakeholders. Thank you.